Thank you for the introduction, and thanks guys for hanging out for my talk. Today I'm going to discuss with you my dissertation work, which was published last year, as well as a little bit of preliminary data that we've gathered recently. So overall, I'm going to discuss with you the effects of dietary therapy on learning, memory, motor coordination, and seizure in an Angelman syndrome mouse model. So just a little bit of background about Angelman syndrome in general. AS is a relatively rare disorder with a prevalence of about 1 in 15 to 1 in 20,000. And it involves disruption of a single housekeeping gene, UBE3A, which is an E3 ubiquitin ligase, that somehow causes all the neurological deficits reported in AS patients, including severe developmental delay, speech impairments, ataxia or tremor, seizures, and an abnormal EEG. Secondly, unfortunately, due to the severity and frequency of seizures in Angelman syndrome, it is considered to be a disorder of epilepsy. And lastly, Angelman syndrome is a relatively new disorder, at least in the realm of research. While it was first described by Dr. Harry Angelman in 1965, it wasn't until 1998 that the first mouse model was created. So it's been about 19 years where we've discovered a lot about the disorder in general. However, therapeutic options are still significantly lacking. So just going a little bit deeper into epilepsy, specifically in Angelman syndrome, greater than 80% of individuals with AS are diagnosed with epilepsy, and typically very early on in life, at least 75% by the age of 3. And like was mentioned previously, a lot of them are admitted to the hospital with status epilepticus, and unfortunately, seizures are a common cause of death in this patient population as well. I've listed the most common seizure types reported in AS patients here, including atypical absence, myoclonic twitches, atonic head drops, as well as generalized tonic-clonic convulsions. So about 77% of individuals diagnosed with epilepsy in AS have intractable epilepsy, or they're refractory to many of the commonly prescribed AEDs today. And unfortunately, this has been linked to both hippocampal damage, if not well controlled, as well as cognitive decline. So it seems overall that the current treatments for epilepsy in AS are overall ineffective. And even if they do have somewhat control of seizure, they have significant cognitive and motor-related side effects, which, as you can imagine, isn't very ideal for a patient population that already has significant cognitive and motor-related issues. So just going a little bit more into detail about the AS mouse model. Like I mentioned previously, it was developed in 1998 by Jiang et al. As a null mutation model. A genomic vector was inserted that created a frameshift mutation and inactivated all isoforms of UBE3A. It does recapitulate the phenotypes seen in humans with AS pretty well, as they have inducible audiogenic seizures, as well as a significant learning, memory, and motor impairments that can be seen in various behavioral tasks. Oops, sorry. So I'd like to touch a little bit about the differences in strain, because I did use 2 different strains for this project. So if any of you guys have worked with mouse models, the C57 Black 6 strain is very well characterized, capable of complex learning on multiple tasks. It does also have the abnormal EEG phenotype that is seen in AS patients as well. However, they do not have the audiogenic seizure phenotype, which the 129 mice have. So we focused on the behavioral aspect more so for the C57s and the audiogenic seizures for the 129s, although we did perform behavioral tasks on those as well. So the hypothesis behind a lot of these neurological deficits reported in AS patients is an overall excitatory inhibitory imbalance in the AS brain. So first, looking in 2012, a group looked specifically in the L2, L3 cortical pyramidal neurons. And what they noticed was a significant decrease in excitatory inputs onto these neurons, but what they noticed was a more significant decrease in inhibitory drive. And this would lead to this overall excitation in the brain and this excitatory-inhibitory imbalance. So this could significantly affect the signal-to-noise ratio, which is important for synaptic function as well as neuronal transmission, and can ultimately cause defects in both sensory information detection and integration, which can affect cognition overall. Now moving into the cerebellum of AS mice, there have been reports of 160 hertz fast oscillations, where 30 to 80 is typically what you see. And another group in 2012 reported a significant decrease in tonic inhibition, specifically in the cerebellar granule cells. So what they decided to do was administer a specific GABA drug called THIP. And not only did it increase tonic inhibition, but it also improved abnormal Purkinje cell firing, as well as, interestingly, significantly improved the ataxic phenotype in these animals. So moving into humans with AS, there was a case study report in 1991 that reported a significant decrease in cerebellar GABA, as well as a significant increase in cortical glutamate, again, potentially tying to this overall excitatory inhibitory imbalance. So the next step involved the focus of my project, which is to evaluate novel AS therapeutics with potentially fewer side effects than the commonly prescribed AEDs today that increase tonic inhibition by either something like increasing the GABA to glutamate ratio or by enhancing GABA receptor function. So I don't have to give background about the ketogenic diet to this group. However, I would like to focus on the various anticonvulsant mechanisms. And I've listed some here, but for the purposes of this project, we focused on the GABAergic output. So this is just basal state metabolism. However, in ketosis, we all know that all ketone bodies generate acetyl-CoA, which enters the TCA cycle via the citrate synthase pathway and would involve significant consumption of oxaloacetate. So the idea here is that there would be more glutamate available because oxaloacetate is typically involved in the transamination of glutamate to aspartate. So more glutamate would ultimately be available to be converted to GABA by glutamic acid decarboxylase in the GABAergic neurons, again focusing on this overall GABAergic output. So looking specifically at the use of the ketogenic diet in Angelman syndrome, there has been a review that reported 100% success in 4 children ages 5 to 8, although they did not specifically define what success was. So there were 2 case studies reported, both an 18-month-old and a 5-year-old with intractable seizures that were non-responsive to both 5 and 6 AEDs respectively, and were reduced both to 1 AED in the ketogenic diet. And this isn't just an example, doesn't show up very well, of the 5-year-old before the ketogenic diet with abnormal EEG and generalized slowing of the background, and then 2 years following ketogenic diet initiation, which was a more normalized EEG. So now I'd like to focus on the various seizure types that I listed previously, as well as the most common treatments in Angelman syndrome. And this table was provided to me by Dr. Douglas Nordley. I believe Dr. Kossoff mentioned him earlier, and he's a pediatric neurologist that is very familiar with the AS population. And this has just been his personal experience with the treatments in Angelman syndrome. And as you can see, 2 treatments stand out to be most responsive AS to most of the seizure types here, being the ketogenic diet and valproic acid. However, as many of you know about valproic acid, it can have some pretty nasty side effects, including confusion, memory problems, behavioral changes, and in the AS population, significant motor issues like tremor, for example. So again, bring the focus of this project to find therapeutics with fewer side effects. So I did mention the ketogenic diet has had some success in the AS population overall. Unfortunately, a lot of these patients have difficulties in gaining and maintaining weight. They also have sensory issues. So for example, they'll gag to the smell of coffee. They also can be very picky eaters. So the ketogenic diet may not be ideal for this entire patient population. So we wanted to try to utilize something that would mimic the ketogenic diet, but wouldn't significantly alter their standard diet. And so we came to the idea to utilize the Ketone Ester Supplementation, and through collaboration with Dr. Dominic D'Agostino here at USF, we utilized the RS13-butane diacetoacetate diester, which has been shown to increase all blood ketone concentration levels regardless of diet. It has previously been shown to induce therapeutic ketosis in both dogs and pigs, and has also demonstrated positive results in a rat model of CNS oxygen toxicity by significantly delaying CNS oxygen toxicity seizures, which was shown by Dr. D'Agostino's group as well. Another group recently also showed there was a significant increase in the PTZ-induced seizure threshold in rats. So this brings me to the experimental methods and hypothesis for my project, which involved administering the ketone ester at 10% total volume of the standard diet. So we were trying to get to 30%. However, in pilot studies of 10 and 20%, one of the strains, the 129 mice, weren't able to maintain the diet very well at 20%. So just for consistency's sake, we administered 10% to both strains. They were fed ad libitum for 8 weeks, and about 10 microliters of blood was taken from the tip of the tail for both beta-hydroxybutyrate and glucose measurements throughout the course of the study. Our goal was about 8 to 12 animals per group, which we ended up with more than that actually, 2 to 3 months of age. Performed behavioral testing, seizure testing, which included the inducible audiogenic seizures by administering 115 decibel white noise until they ceased or for a maximum of 60 seconds, as well as chemically induced Kainic acid injections, which chemically induced seizures are more translatable and typically looked at prior to use of AEDs in clinical trials. We also performed electrophysiological testing, specifically hippocampal LTP, and performed metabolic analysis. And the hypothesis was that the ketone ester would decrease seizure frequency and increase the latency to seize, improve learning and memory, and synaptic plasticity in the AS mouse model. So first we wanted to look at overall general locomotor activity and anxiety, as can be seen by the two behavioral graphs here. So first, looking at the open field, you place the mouse in an open field arena and they're able to explore for 15 minutes. And you look at the overall distance traveled. And as you can see, there's no significant differences between the groups, suggestive of no significant differences in general locomotor activity. Additionally, we looked at the elevated plus maze, which is in the shape of a plus with 2 closed arms and 2 open arms. And you look at the overall percent time spent in the open arm, with more percent time spent in the open arm being an indicator of decreased anxiety. And as you can see here, we also didn't find any significant differences, at least at 10% of the ketone ester diet in anxiety. So with no differences here in locomotor activity and anxiety, this shouldn't be affecting any of our other behaviors negatively as well. So next we wanted to look at object recognition memory, which involves the cortex and hippocampus. So after initial habituation in an open field arena, you place the animals in the same arena with 2 objects, and they're allowed to explore both of these objects for about 10 minutes. Then 24 hours later, you place them again in the same arena and replace one of these objects with a novel object and allow them to explore for 5 minutes. And just due to their general exploratory nature, they're typically going to spend more time with the novel object than the old object if they remember being with both objects the day before. So what we end up looking at is exploratory preference, which takes into consideration the amount of time spent with the novel object over the percent time or the overall time spent with both objects. So anything above 50% is considered intact object recognition memory. And as you can see pretty clearly here, the AS group is the only one to fall below that 50%, so there was a significant decrease in AS compared to wild type, which was significantly improved with ketone ester treatment. Additionally, we looked at the discrimination index, which was also the same data, just looked at in a different way. So it's looked at the difference between the time spent with the novel object, subtracting the time spent with the old object over the total time spent with both objects. So anything below the x-axis is actually more time spent with the old object, which the AS group was the only one to do so, which was, again, significantly improved with ketone ester treatment, again, suggesting an overall enhancement of object recognition memory. So then we want to evaluate motor function, like the other group did when they gave the GABA drug and saw improvements in ataxia. So we place the animals on a rotarod, and specifically an accelerated rotarod that accelerates from 4 to 40 RPMs over the course of 5 minutes, which is an evaluation of both motor coordination and motor learning. And what you look at is the overall latency to fall off the rod. And you see between the wild type group and the AS group has a significant decrease in latency to fall, suggesting a significant decrease in motor coordination, which is significantly improved with ketone ester treatment. Then we wanted to evaluate subacute muscle function via the wire hang task. And what you do is place the animals on a thin wire and they're allowed to hang on with their 2 front paws. But if they can pull themselves up completely with all 4, they can and are allowed to do so. However, this is typically seen with our wild type animals, while the AS mice typically struggle to hang onto the wire. So you again look at the latency to fall, or for a maximum of 60 seconds. And what we saw was a significant deficit in the latency to fall in our AS animals compared to wild type controls, which was significantly improved with ketone ester treatment, suggestive of an overall improvement in motor function. We also wanted to look at the hind limb clasping reflex, which is not just an indicator of ataxia, but also overall neurologic function. So what you do is take the mouse by the tail and lower it for about 10 seconds and look at the hind limb form. And what you'll see is a score of 0 is normal. What you see in a wild type animal, typically the hind limbs are consistently splayed outward away from the abdomen. And a score of 3 is where the hind limbs are entirely retracted, touching the abdomen in this clasping form, which you would typically see more so in AS mice. And what we saw was a significant decrease in this clasping score in our AS treated animals compared to AS controls. And then just in general, we wanted to look at beta-hydroxybutyrate levels throughout the course of the treatment compared to baseline, and looking at both week 1 and week 8 in both wild type and AS treated animals, we saw a significant increase in beta-hydroxybutyrate, suggesting the ketone ester was working as expected. Then we want to evaluate hippocampal LTP, or long-term potentiation. And we want to evaluate this because it's thought to involve mechanisms underlying learning and memory. And as you could see previously, we did already see improvements in a learning and memory phenotype. So I want to draw your attention to the bottom left graph here. And what we do is, after stimulating the Schaefer collaterals of the CA3 of the hippocampus and recording from the CA1, we look at 20 minutes of baseline and then give a theta burst stimulation. And this theta rhythm is thought to mimic learning. And then you look at the slope of the field recordings, or the EPSPs. And what you see is a significant deficit or decrease in synaptic plasticity in our AS animals compared to wild-type controls, which is significantly improved with ketone ester treatment, although not completely restored to wild-type levels. And this was seen without any significant changes in basal synaptic transmission, as can be seen by no significant alterations in the slope of the EPSP, as well as no significant alterations in PPF or short-term synaptic plasticity. So then just in general, I wanted to mention for the Kainic acid, we looked at a modified Racine scale for the behavioral seizure score from stage 0, which is normal behavior, to stage 7, which is death. And just an example here is stage 4, which is screenshots of our animals rearing and falling. So then looking at the overall potential anticonvulsant activity, and again, all of this data has been in the 129 mice. We have not gotten to the C57s yet. So looking at the Kainic acid seizures, we didn't see significant decrease in the behavioral seizure scores throughout the course of the time post-Kainic acid injection. However, we did see significant differences at various time points at the beginning and the end, suggesting we are affecting inhibition somewhat. In addition, as the latency to stage 2 seizures, as they're getting more severe, we evaluated that in both AS and AS ketone ester treated animals, and it was significantly increased in the AS ketone ester treated mice. So then look at the audiogenic seizures. After stimulation, we pretty much said yes or no. Did they have an audiogenic seizure? Which at that point, they had to have tonic-clonic convulsions. That would be the yes. And we see just an overall categorical data, a significant decrease in the seizure frequency in AS animals or treated animals compared to AS controls, and also a significant increase in the latency to seize in our treated animals as well, suggesting overall that the ketone ester was anticonvulsant in our AS mice. So then we wanted to evaluate spontaneous epileptiform activity. And this would be evaluated by looking at overall number of polyspikes per day. So spikes in general are waveforms that are very fast, less than 200 milliseconds in duration, with a peak amplitude that's greater than 2 times the baseline background amplitude. And then polyspikes are any of these spikes that cross the baseline more than twice. So initially, I implanted doing wireless telemetry, and so you're recording and utilizing the electrodes placed on top of the dura. So the resolution is all right, but if you already have an AS mouse, for example, which has an abnormal EEG, it's a little bit difficult to differentiate between the abnormal EEG and the polyspike activity. So we decided to collaborate with Dr. Anna Anderson at Baylor College of Medicine, and she is very familiar with not only the AS animals, but hardwired EEG recordings. So she performed these recordings in both, or I guess in all, C57 mice, 129, as well as a hybrid of the two. And she saw pretty clearly that the C57 mice had a significant increase in polyspike activity, per day in the AS animals compared to wild-type controls. And this is just an example of the representative baseline EEGs in both wild-type and AS mice in the cortex and hippocampus. And you can see this polyspike activity in both the cortex and the hippocampus in the AS mice. So we haven't started work with this completely, but that is the goal. And we will be doing that in the C57 animals. So moving forward into the C57 data, we have seen a significant increase in weight in the AS mice compared to wild-type controls, which was normalized with ketone ester treatment. And again, like what we saw with the 129 mice, we saw significant increases in beta-hydroxybutyrate throughout the course of the study. So then we again wanted to evaluate motor function in the same way. So what we saw with the 129s, we saw a significant increase in the latency to fall on the rod compared to AS, or in AS treated animals compared to AS controls, although not as drastic as what we saw with the 129s. We also saw a significant increase in latency to fall on the wire hang task compared to controls, as well as a significant decrease in the hind limb clasping score, suggesting an overall improvement in motor function with the strain as well. So then we wanted to evaluate associative learning. And this was using a fear conditioning paradigm, and it was a 2-foot shock paradigm where you place the animals and pair a foot shock with a tone. And then 24 hours later, you can place them in a novel environment and not play the tone for 3 minutes and then play the tone. And typically when you play the tone, utilizing their amygdala, they will remember from the day previously, and they will be in this freezing form. And so you look at the overall percent freezing. And we did not see any significant differences between any of the groups here in cued fear conditioning, which we did not expect and do not see deficits typically in AS mice. However, in contextual hippocampal dependent fear conditioning, where you place the animals in the same environment the next day with no tone, no foot shock, as an indicator of associative learning, we did see a significant decrease in freezing in the AS animals compared to wild-type controls, which is significantly improved with ketone ester treatment, again suggesting an overall improvement in associative learning. So overall, as a summary with all of this data, I know between two strains can be a little confusing, but anything bolded in blue here were any overlapping similarities with learning and memory related activity. Anything bolded in orange were similarities in motor improvements, which actually ended up being the same tasks. We also saw significant decrease in the seizure phenotype in the 129 mice, as well as a normalization of weight in the C57s. So then we wanted to look at the metabolic analysis. And overall, we wanted to look at both GAD65 and 67. If you can remember, GAD is involved in the conversion of glutamate to GABA. So potentially if we saw increases in that, we could be increasing GABA. So interestingly, in our AS mice compared to wild-type controls, we saw significant decreases in both the GAD65 and 67 compared to wild-type animals, which was significantly upregulated in AS ketone ester treated mice, suggesting we could be increasing GABA. So we wanted to explore this further, and we did send off samples to Case Western Reserve University to look at both glutamate and GABA. And first we looked in general too, we sent plasma levels as well as the hippocampus samples. And for the plasma was just to see if there were also alterations in acetoacetate as well as beta-hydroxybutyrate. And we did see significant increases in both wild-type and AS treated animals. And interestingly, we did see a significant increase in the GABA to glutamate ratio in the AS treated mice compared to AS controls, again suggesting we could be affecting this overall inhibition. And that was in the 129 mice, and with the CBD7s, very similar results, significant increases in both beta-hydroxybutyrate and acetoacetate, as well as a significant increase in the GABA to glutamate ratio in the hippocampus. So in summary, 8 weeks of ketone ester treatment increased beta-hydroxybutyrate levels throughout the course of treatment, was anticonvulsant, normalized weights in the CBD7 mice, demonstrated motor improvements through various behavioral tasks, as well as demonstrated significant object recognition and associative memory improvements. It also enhanced hippocampal LTP. For the metabolic analysis, we saw significant increases in both GAD65 and 67, as well as an increase in the GABA to glutamate ratio. So the idea here is that this novel therapeutic could have efficacy in treating seizure frequency and threshold, which could affect cognition in Angelman syndrome. And this also supports further investigation for clinical use as a symptomatic treatment for AS. So in the future, we would like to look at inflammation, not only in the brain, but peripherally as well. We'd also like to place the mice in metabolic cages, which we have done and are combing through that data right now. We'd also like to increase the volume of the ketone ester, at least in the C57 mice that did respond well, and use potentially the ketogenic diet or an anti-epileptic drug as a control. We'd also like to perform PTZ evaluation instead of Kainic acid, especially in light of the group that saw a significant increase in the PTZ-induced seizure threshold in rats. And we also like to perform real-time measurements of GABA glutamate after, for example, a bolus of ketone ester, utilizing microdialysis. And in general, we'd like to also evaluate mitochondrial biogenesis, looking at overall activity, structure, and function. And so very, very quickly at the end here, we have created a rat model for Angelman syndrome through CRISPR technology. Not really allowed to say a lot about it, but for the purposes of this conference, I will show this brief data very quickly. So again, in light of the other groups showing the significant increase in the PTZ-induced seizures, we did give one significant convulsive dosage, 70 milligrams per kilogram of the PTZ to these rats. And again, used a modified Racine scale from stage 0 to 4 for the rats specifically. And so we determined this timeline in collaboration with Dr. D'Agostino's group, specifically talked to Dr. Poff. We initially took baseline ketone and glucose measurements in the morning, did a 4-hour fast, and then gave an oral gavage of the ketone ester at 5 grams per kilogram or water as a control. And then an hour later, I also did ketone and glucose measurements and then gave the PTZ injection and then recorded the rats for an hour. And then in general, the seizure stopped around 30 minutes, but we wanted to go through the entire hour just in case. But all of them were finished, they finished their seizures by the end of 30 minutes. And then we wanted to look at 4 hours post-gavage at the ketone and glucose measurements, because typically what they had seen was a significant increase even 4 hours post-gavage. So something interesting I just wanted to point out, there were no significant differences in weight between the groups, which is a little bit different than what we see with our mice. The glucose levels, we see a little bit of a drop after ketone ester gavage, which is also what Dr. D'Agostino's group has shown. However, we see a significant increase in glucose in all groups, not surprising after the stress of seizure activity. And then the blood beta-hydroxybutyrate levels, significant increase in obviously the ketone ester treated rats, which typically is maintained at 4 hours, but there's likely significant utilization of the ketones during the seizure activity as well. And then very quickly, stats haven't been run on this. It's very preliminary data, so this needs to be we need to add a significant number of animals. But in general, it seems that the AS rats do seem to potentially have a significant increase in the behavioral seizure score throughout a longer period of time post-PTZ administration and compared to wild types, and the AS ketone ester treated rats potentially have a significant decrease. We'll see as we add animals. But looking potentially at the generalized convulsions, which were stage 3 and stage 4, and the latency of those convulsions were significantly increased in the ketone ester treated rats compared to wild type and AS treat or control animals. And this is interesting because a lot of these animals did not even reach the stage when all of the animals reached stage 3 or stage 4 in these groups. And this is just a brief breakdown of stage 2, 3, and 4. The AS ketone ester treated rats spent more time in stage 2 was actually the partial clonus, so it's not as severe as the other 2 stages, not the generalized convulsions, which could potentially looks different than or decreased compared to the other 2 groups, with the AS treated or the AS control rats, potentially have a significant increase in convulsion duration overall. So it'll be very interesting to see how the data plays out and also to see how the wild type treated animals results look. So I'd like to thank the Weber Lab, my collaborators, Dr. Dominic D'Agostino, as well as Case Western Reserve University, and the Foundation for Angelman Syndrome Therapeutics for funding the majority of this project, as well as my committee members for my dissertation.